What is up, you guys? My name is Austin Marks and welcome back to my YouTube channel. So in today's video I'm here with my wife Brianna, who is currently a physical therapist assistant, also known as a PTA. So that's what we're going to be talking about today. So we're going to be going over what a PTA is, the schooling, the salary, and other things like that. So what is a PTA?
So a PTA assists the physical therapist, and they do a lot of stuff that helps people gain back their range of motion, their strength, and basically watches their functional mobility and stuff like that, and helps them get back to the lives that they were living before they got the injury or surgery or whatever they had.
So do you want to tell us what it's like a day in your job?
So a day in my job, I come in and so where I work, we have patient flow sheets where we keep track of everything that they are doing in their treatment session. And so we gather those for the day, and when the patients come in, we just basically have them go through their exercise program. We do a lot of hands-on manual therapy, where we're stretching them, helping them gain back their range of motion and stability and stuff like that.
So what type of patients do you work with? You work with like young athletes who maybe sprained their ankle, twisted their ankle, or people who got like shoulder surgery, something like that?
Yeah, we work with a lot of different varieties of patients. So we work with anywhere from a 2-year-old or a baby up until I've had patients in their 90s as well. So we work with people that have come out of a surgery, shoulder surgery, knee surgery, ankle surgery, any kind of surgery basically, like orthopedic surgery. And we work a lot with low back pain, sciatica, stuff like that, pretty much any body part.
So where are some different places that PTAs can work?
PTAs can work basically outpatient or inpatient. So anything outpatient is like a clinic where patients come to you, to like a gym to do their therapy, and inpatient is settings such as hospitals, nursing homes, long-term care facilities, stuff like that. I think there's also some opportunities to work in like home settings, like go in and visit people in their homes and help them do their therapy. And then there's special clinics, sometimes like spinal cord injury clinics and specialty clinics like that.
So I know that PTAs work closely with the physical therapists themselves. So what's the difference between a PTA, a PT, and a PT aid?
So a PT aid I actually was throughout my college. I basically went in and I helped assist the PT, the PTA with anything they needed help with, such as like getting patients their bands or weights or different things that they needed to perform the therapy. I did a lot of cleaning tables, laundry. I did some clerical work, so that's like stuff with paperwork and just recopying charts and stuff like that. And then a PTA, basically, I explained in the beginning, so they come in and we help them do their exercises and we do the hands-on stuff with them and we do their treatment program. But then a PT, they are the ones that do the initial evaluation. They come up with the plan of care for the patient, and they basically are the ones that make all the decisions on the patient care. A lot of times, like if you have experience and you have worked with a PT for a long time, you start to learn their way of doing things, and they start to trust you to make some of those decisions on your own, such as like progressing patients and talking about their plan of care with them a little bit. But PTAs, they just need to make sure that all of this is okay with the PT before they make any like final decisions like that.
So I know as my job as a respiratory therapist, I need to get continuing education hours. So how does that work as a PTA? How many do you need?
So a PTA needs 30 continuing ed hours every 2 years. So we renew our licenses every 2 years, and that is when you need to have those 30 units done by. And a lot of times if you work in a clinic full-time or part-time, some of the benefits that come with that is continuing ed that is paid for you.
So how does a person become a PTA?
So for a PTA, you need to have an associate's degree from an accredited college. So that's 2 years. I took a little bit longer because I did gen eds at a community college, and that just took me a little bit longer because I wasn't 100% sure what I wanted to do. So you can also get a bachelor's degree in physical therapy assistant. As far as I know, really the only benefit to doing that is if you want to continue your education even farther than that, or if you want to teach at a college, like be a professor.
You want to talk about the salary for a physical therapist assistant?
Yeah, so where we live in central PA, and a lot of time, well, our cost of living is not super high here, so this is probably going to be fairly low depending on if you live in like a big city where the cost of living is a lot higher. But starting rate for an outpatient PTA is around, I believe, 40,000 a year, and then to work inpatient, you do get paid a little bit more. And from my research, you do get approximately about 50,000 a year, so about 10,000 difference working inpatient and outpatient as a starting PTA.
So what is the job outlook for a PTA?
So the job outlook is really good. I really didn't have a hard time finding a job out right when I got out of college. PTAs and PTs are always needed because the healthcare field is always growing, and there's always people that are going to be having sports injuries, older people having falls, anyone having surgery, anything like that. It's just a really growing community of people.
So do you like your job, and if you had the choice, would you do it again?
I love my job and I love helping people, and it's very rewarding seeing people come in and being able to barely move or have significant weakness or being in a ton of pain. And then by the time we discharge them, it's really cool to see how far people have come, and I would definitely do it again.
So that basically covers everything about a PTA. So if you guys have any questions, go ahead and leave in the comments, and my wife will go ahead and try to answer them. Go ahead and leave this video a thumbs up, and make sure you like and subscribe. Make sure you give it a thumbs up if you think my wife's hot. See you in the next one. Are there any specific diseases that could be treated with physical therapy?
You didn't tell me you were going to ask that.
No.